Well, welcome to the Alexa Conference here in Chattanooga, Tennessee. I am with two new friends from the Mayo Clinic. Would the two of you please introduce yourself and let everybody at Voice First FM know, and you can just talk with me. I mean, they're there watching. You're just here to observe a conversation we're having. So introduce yourself to me, of course, for the camera as well, and what you do at the Mayo Clinic.
Hi, I'm Joyce Even. I'm the Vice Chair of Content Management and Delivery in Global Business Solutions at Mayo Clinic.
Great, great.
Hi, I'm Sandhya Pruthi. I'm a physician and I am also the Associate Medical Director for the Mayo Clinic Global Business Solutions Content Management and Delivery.
And you're also an incredible public speaker.
Thank you.
The
Thank you.
keynote you gave yesterday morning was amazing.
Thank you very much.
Yeah. So I want to ask the two of you a question each. And so in just a moment, I'll ask you about the future. So get that visionary mind going. But I'd like to talk about today. So tell me, what do you do at the Mayo Clinic as an organization? Why are you involved with Alexa? Why are you here at a voice conference? And how's this conference been? Like, just talk to me a bit about what you're working on in this conference. And just give me some insight.
So for 150 years, Mayo Clinic has provided trusted health information. And our mayoclinic.org website is one example of where we share Mayo knowledge with our consumers and patients.
Yeah.
And we have also watched the evolution of where health information has gone from digital, mobile, web, and now voice.
Right.
And so we were excited to get into the space with voice with our Alexa first aid skill.
Right.
And have watched how well received that is, and we think healthcare information can be received many ways by the end user, and voice is an example. And we are continuing to want to work in that space today.
That's great. How's the conference been? What's been a highlight from yesterday, the first day? What are you looking forward to today? And how's Mayo Clinic? You know, what's the call to action for people at this conference? Maybe people that watch this live video or watch later. What does Mayo Clinic want to engage people with?
So if you're going to provide health information, what I really believe and what Mayo Clinic wants to make sure is that the information is accurate, it's trusted, and it's good information.
Right.
Health information is important, and we want to be at the forefront of making that available to patients and consumers. And I would expect that from others who want to also get involved in this space.
Yeah, that's great. And then as far as like looking forward to just this year, the stuff that you're working on now, what is a thing or a couple of things that Mayo Clinic is doing in the voice space that you just would like the world to know about?
So I think more than just providing health information, more in the clinical setting, what about improving the interface between the provider and the physician using voice? There's a lot of clerical burden around the use of the EHR and how we could potentially help see voice in that role to improve my workflow.
Yes.
And I think even more exciting is a little bit into the clinical diagnostics of voice. And I shared some work at Mayo that our researchers have been already leading the way in clinical diagnostics and the use of voice signal characteristics to help us diagnose disease, and for example, coronary artery disease. And so I think that
With voice technology. I
I
saw a demo, very private.
Yeah.
I'm not allowed to talk about it. It's very unfortunate. What can I say? There is a technology that by you talking, it can tell things like your blood pressure.
Yes.
It can tell things like potentially some more serious diseases like you just mentioned. If you think about that being on a consumer level in the near future, like consumer access, and what happens when we start to deal with preventative care in an automated fashion, it's very, very, very powerful.
And what if it helped address disease earlier
That's
in
right.
the spectrum of where disease can be, we call it preventive or early versus chronic. And I think we would want to be able to provide good care at an earlier point in time, but to also maybe be able to do it as care at a distance. Not everybody can come to bricks and mortar and get their care. And think about how that can help us care of at distance.
Yeah, that's great. Well, let's talk a bit about the future. So, one of the things I'm fascinated about is obviously there's a lot of energy, like, here's what we're doing right now, and here's what we're doing this quarter. And of course, there's a reason for that. But, like, what if we project out 5 years? Like, what is Alexa 2024 technology in partnership with the Mayo Clinic technology team and the innovation team? Like, what could that look like 5 years from now, in your opinion?
Well, I think Dr. Pruthi touched on some of that. How do we leverage biomarkers? How do we leverage what we also know about the individual beyond the biomarkers to their socioeconomic status, et cetera? How do we take all of that big data and incorporate it with the voice technology and all the wearables and other devices that can be attached to voice technology to really understand the whole person?
Yeah.
I think it's a part of the tool set with other tools that will help with earlier diagnosis. And to me, that's where it really needs to move in healthcare. How do you prevent someone from getting that chronic readmission type activity happening? Because that's what really drives up healthcare costs. I believe too that there's going to be a shortage of physicians, and how do we better help with that workflow?
Yeah, that's a great point.
Because they're very burdened today. Most organizations do have EHRs, electronic health records,
Yes.
which was to improve the capability of the flow of data, but it's really been a burden to physicians. So I think over the next 5 years, and because of more shortage of physicians, we will begin to see an evolution of where voice actually helps in that physician workload.
Yeah.
Help make the orders, transcribe, et cetera, that will be happening. That today they just have to take time to sit down, be at a computer and do all of that. We really need to get them beyond that and have more time for the patient. So I think in 5 years we'll see significant change in that way. I don't think voice will totally replace everything, but it will be supplemental to other tool sets that they have today. And if they can help them with honing in on a diagnosis because of knowing more about the individual, I think that'll be a very positive change.
What do you think, and maybe both of you could answer this, we could kind of end with this question. It's kind of a two-part. What will, in your mind, 5+ years, you can go out 10 or 50 years if you want, what would be an unexpected benefit of voice tech for medical professionals, and what would be an unexpected benefit of voice tech for patients?
The word that comes to mind when you say unexpected benefit is individualized medicine. I think more and more, if I look at the future of what our millennials, our patients are looking for is provide the care that's unique to me and when I need it. And I think they're going to want to be able to say, get me an appointment with this doctor on this date, on this time, with this specific need. And that's around personalization and individualized care.
Yeah, that's great. That's great. Any thoughts
I
from you?
would agree with that. I think the whole personalization and trust in this technology will be critical. So if we see that people really do trust this and it does assist in lowering the cost of healthcare, that will be very positive.
Yeah, that's great. Thank you so much for taking a moment to let me live stream a little interview you, talk about today, talk about tomorrow. I want to thank you on behalf of everybody that is impacted by Mayo Clinic, which is probably the nation.
Great.
Thank you for your work as individuals. Thank you for the leadership that you provide to your team, people like Sean, you have amazing people on your team, and just keep going with great confidence. We really appreciate it.
Well, you're very welcome. Thank
All right,
you.
thank you.
Thank you.
All right, YouTube will be back soon.
Thanks.